So I want to start this video off with a disclaimer. I am not a doctor, and this video is not intended to be advice in any sort of way. I'm simply going to tell you what I did to heal a fractured ankle and my thought process behind it, why I chose to do certain things, and the different suggestions and approaches that were recommended to me, and how I took all that information and created my own treatment. So the first thing I want to talk about, it might come as a surprise to you, but it's actually my mindset going into this. So I think that the mind is incredibly important when you have some sort of injury or setback, and how you approach and feel about what's happening, and how you can empower yourself to take control of the situation to the best of your ability. Now, the things that I focused on were, how can I look at this as an opportunity, as a blessing? And the things that I found when I posed that question to myself was, well, I'd actually fractured my left ankle when I was younger, and now that I'd fractured my right, my left leg has always been a bit weaker. So this is now an opportunity to strengthen that left side. I also saw it as an opportunity to practice some of the things that I've been learning this year about tissue healing and joint function, and to dig a little deeper into that subject. So when it came to looking at healing a fracture, I looked at three primary components. So you have stability, you have blood flow, and then you have what I would call nutrition. And let's put a fourth in there. Let's talk about appropriate amount of stress. So balance between rest and stress to the injury. So the first one, stability. There are three primary approaches to take. What was recommended to me was to initially just put on a walking boot. And then a week later, when I saw the orthopedist, they recommended that I actually have what they call open reduction internal fixation, so plates and screws. Now, I'm not a stranger to this. I actually have 2 plates and 8 screws in my jaw here, and then I have a screw in my left ankle when I fractured that one. So I've had these before. I didn't ask the appropriate questions when I had these surgeries previously, and both of those fractures were only hairline fractures, and looking back on it now, if I had to make those decisions again, I would not have had those surgeries. And I thought about that in this process. Well, am I avoiding surgery because I'm jaded about those last times that I had surgery where I feel like I didn't, and would it be a mistake in this situation when I actually do need surgery to not get it because of those mistakes?
So this is that view there. It didn't seem to really change anything on that view, but when they do that gravity stress, you see how that moves significantly there? Yeah. So I'm concerned that with that movement there, this is something that we may need to have the surgeon fix, okay? Okay. So what I'm going to have to do is get on the phone with them and have them take a look at this and then tell me what they recommend, okay? But I anticipate that's probably...
Hi, this is Shelley calling from the hospital. We just have you scheduled for surgery today. If you can give us a call back, the number is...
A week after the fracture, I was recommended to go into surgery the next day. They actually had it scheduled. They called me in the morning, and I told them no, because I wanted to do some further research. So during this time, all I had was a walking boot, which I went and purchased from a thrift store for $2. They try to sell them to you for like 50 or 60 bucks, and I didn't want to go that route. So they have that, or people were saying to me, like, why don't you have a cast on it? Because all I used the entire month that I was healing was this ACE bandage. And the thinking process behind that was that if I get a cast on, by the time the swelling goes down, it's going to get loose, and I would need another cast. And looking at the bone healing process, I had a massive amount of swelling in the top of my foot, and I think 2 things, like, that could be potential nerve damage, and that can also be that old bone fragment that broke down. It needs to dissipate somewhere, and my guess is that it becomes a very acidic environment, and the fragment breaks down, and then I think it gets essentially released through the skin. So in my thinking process was, if you have a cast that's covering that for the entirety of the healing process, then that's going to make it more difficult to have that natural healing process occur. As well as, I wanted to do things like, I would go out in the sunlight daily, and I would still ground my foot. So I would have it in the grass, just trying to treat it like a garden almost, like get at the natural things that a human body needs. So that's why I chose not to get a cast on it. Now, with the ACE bandage, the advantages I saw was that I could adjust it to whatever it needed that day. As the swelling changed, I could keep it stable with, because it ballooned out and then it shrunk back down. So it was more adjustable in that way. The walking boot, I put it on once and I took it off and never touched it again. And the reason for that was that the disruption of getting in and out of the boot to the injury, I thought wasn't really worth the risk for the stability that it provides. And on top of that, when I did want to move around, if I have to go to the bathroom, or I would take a shower like every 3 or 4 days, just the added weight of the boot on the leg made it much more stressful for my right hip, and it was just clunky to get around. So if you're in reasonably good shape, I think, and you can be pretty mobile, I had the advantage of being a rock climber, so I'm used to kind of like wedging myself between things and moving around, which was really helpful through this process. So I think the boot, not only stability, but I think a lot of people get an added benefit of it from like a protective barrier. As long as you can be relatively careful with the injury and not bump it into things, I thought that the ACE bandage did fine for my purposes. So let's talk about the actual function of the ankle and how I treated this. So you have your shin bone, which is your tibia, and it has like one prong on the side of it. And then you have your fibula, which starts from behind your knee and then it comes down, and it's this like second prong here. So it's almost like a tuning fork kind of thing. And then you have your talus, which is it's basically like a square shaped bone. And then they fit around the ankle like this. So what happened to me was I fractured the fibula, which is the lateral side there. So as you can see now, I don't have any stability on this side. And when they're looking at surgery, they're looking to see, do you have a pretty even gap all the way around? And if you have like instability there, is it going to heal like out of shape like that? So they do a weight bearing test to see how the tibia shifts like around this. And mine was only slightly off. So when they have you do the gravity test, they take your leg and they turn it to the side, and then it's just weighing there. And I think for the most part, if you have an injury like this, whatever is going to cause the fracture to be unstable will likely also cause pain. So it's not something you're really going to be doing that often. So throughout the whole process, I wanted to keep my ankle either in plantar flexion or dorsiflexion. I didn't want any rotation at all, because that would have the bone basically slide past, because the fracture itself was on an angle. So if I were to twist, it would make the fracture become unstable. So the whole time I was keeping my ankle pretty frozen in either flexion. And yeah, when I would take a shower, I would try to put my knee on something and rest it so that I wasn't rotating in any sort of way. Further on the topic of surgery and why I chose not to do it, I looked into how the doctors make the decision of whether or not to get surgery. So they look at two different classification systems. One's called the Weber and the other is the Log Hansen. I'm not sure if I'm pronouncing that correctly or not. Though the Weber classification, they're looking at if the fracture is below where the ankle joint is, then typically it's stable enough that you don't need surgery. They're saying if it's at the fracture level or if it's above, typically it's going to be too unstable, and that's when they recommend surgery. So for mine, it was basically right at the ankle joint. They call it the ankle mortise, and I didn't ask the surgeon. I might next time I see him, but I believe that's why they recommended. And then the second classification, the Log Hansen, is they look at basically what position was the foot in whenever the fracture occurred, and what was it doing. And one thing that's kind of misleading about x-rays is that it doesn't show any soft or connective tissue. So you don't really know what tendons and ligaments are still intact that are keeping that stable. The next thing I want to talk about is blood flow, and that was another reason that I didn't want to have a cast on or something too tight, because I wanted to get as much blood flow to the area as possible. I think because we look at bone as a more dense tissue, it's easy to forget that it's in a fluid medium. And I picture the blood vessels and that type of stuff, it's like reconnecting the inside of the bone. I picture it almost like vines growing up a lattice, something like that. Like they need blood flow and support to reconnect inside the bone there. So that was something that I still wanted to get movement. Like I said, I did plantar and dorsiflexion to it to get new blood supply to the area. And I wanted it to not be too tight, that there was adequate blood flow to the area. Because I've had casts on before where I've taken it and it essentially looks like you've killed a part of yourself. Because the muscle atrophy and the lack of sunlight and all the dead skin and the decreased oxygen in the environment, it looks like it just kind of wreaks havoc on the whole site. So that was something that, more than anything, I just wanted to experiment and see what would happen if I didn't go that route. And lucky for me, it did turn out successful. First and foremost, I wanted to have as much fresh fruit and berries and like leafy greens as possible. So I know that I read a long time ago that parsley was really good for like growing nails and hair and that type of stuff. So every day I would do a smoothie. I would probably do like 2 or 3 of them actually. I would do a banana with frozen blueberries, a little bit of orange juice, and parsley and spinach. Maybe a little bit of peanut butter or something like that. I try to avoid like any grains or legumes as much as possible. So that was trying to get like hydration and antioxidants and amino acids and all those good things as much as possible into my diet. And then I was doing a lot of soups, so like bone broth. I would get pho and get specifically like I wanted the tendon. I think in a very general sense, like supports like in the body. So getting that like connective tissue into my diet. I was doing that just about daily for at least the first 2 weeks. And then I wanted to get as much vitamin C as possible. So I was supplementing with it, and I was also eating a lot of like fresh pineapple, oranges, orange juice, those types of things. And then I also wanted a lot of vitamin D as well. So yeah, I was supplementing it, as well as I was eating lots of white mushrooms. I would basically saute those with some green beans every day and put a little Parmesan cheese on top, and that was kind of my staple meal for the day. And then I was also supplementing with, I have here This is Great Lakes Gelatin, and I would make Jello with this pretty much daily. I would eat like a bowl about that size full of Jello every day. And I have a video of how to make that I could link to in the description. And then I was also taking, this is Broken Bone or Not. This is one of my favorite supplements, which is Natural Calm, and this is Magnesium. So I would drink this every night before bed. You basically just make, I don't know, like a cup, half cup of hot water, and then mix it with that, and it fizzes up, and then you drink that. So those were the main nutritional approaches I took towards the healing process. I talked a little bit about sunlight and those types of things. I want to talk about some other topical care that I did. And the first one being, this is Comfrey Oil. Let's see if I can get it to focus. So it specifically says on there for skin rejuvenation. And I had watched some other videos of people who made, I think it's called poultice, where they'll get the actual herb and then they'll mix it with like hot water in a wrap, and then they'll wrap that. And that was very expensive to do. I think it was like $30 a pound for that. So I thought that the oil was a more efficient replacement for that. And then I had some lotion here. I have a lot of friends who are massage therapists, so I think somebody probably left this here. But this is, it's a warming lotion, and it's for tension, aches, tired feet, stiffness, and it specifically has a lot of stuff that I wanted in it, which was aloe, which is really good for skin healing, peppermint oil, and some menthol. So it had a really good like warming effect on it. As well as I did a lot of heating, so I have a heat pad, and I would wrap that basically around the bottom part of my shin 4 or 5 times a day at least, and I would sleep with it on too, which probably wasn't great. I could have caught on fire or something. But yeah, on that topic, I think there's newer research that says, I believe I heard one of the gymnastics, Chris Summers, talk about this, that for most injuries, ice is only good in the first 24 hours, and then after that you want to actually do heat as much as possible. So that's why I did that. I think now that for the beginning of the injury, the swelling, I think my guess is it actually aids a lot in the stability of the injury, as well as like not wanting to move it. So I actually didn't want to reduce the swelling, and I saw a lot of things that avoided taking like NSAIDs. I took some aspirin right after it happened, which I kind of regretted doing after the fact. But throughout the whole process, I didn't have any sort of painkiller or anything like that. And I'm sure that's different for every injury. Like, yeah, some are probably definitely more painful than others. Yeah, that was my healing process. Now, I had the surgeon, when I saw him, it was exactly 1 month since the injury, and the fracture looked good. And he actually recommended that I put a walking boot on and I start walking on it, which, based on my knowledge from functional range conditioning, that's not the best advice. And I think that the doctors, they mean well, and they're going based off what they were taught, and they've probably been doing for years. And I don't think that they're like malignant in any sort of way. I just think that they're maybe not looking at newer research or thinking about how humans relate to nature and what actually takes to grow tissue and rehab tissue. So I have not been walking on it yet. I've started with small isometric contractions and small range of motion with the injury, and I'll continue to progress that until I feel like it's ready to actually start weight bearing on a more consistent basis. And then I have a program that I want to give a try by Cal Dietz, and it's called Spring Ankle. So I'm looking forward to making my ankles stronger than they were before the injury, especially for rock climbing, because jumping off of boulders and taking falls, you definitely need strong ankles to support that kind of force. So I'll probably update with some videos about that in the future. But for now, thanks for watching. If you liked the video, I'd love to know. You can hit the like button. And if you want to see more videos like this, you can subscribe, and I hope to be putting out more content in the future. Take care for now, and I hope to see you soon.